worked perfect the first time, and now it's giving me. Sorry.
Okay.
All right, so is everybody, everybody's good? Nancy, we don't see your face, but we think we can hear you. Can you hear us? Nancy?
Working on it.
All right. Heard you at least. So it's 12 o'clock or thereabouts, and if Al were with us, he'd whistle and we'd get started. I'm not about to do that. So this is the June session of the Finance Committee, and we're going to call the meeting to order. And the agenda is Rhonda through the whole afternoon for us. So the first item is the fiscal year 2021 budget presentation. So, all right, so we got it up on the screen.
Let me make sure I can see.
Now, Rhonda,
Okay.
the floor is yours.
Go ahead and go to page 2. There we go. This is the same presentation that you saw at the last board meeting. At that time, we told you that we did not know how fee revenue was going. We did not know about state funding, federal block grants, or local funding. So I'm happy to report that it appears that we will receive the same local funding in fiscal year 2021 as we are receiving this year, and it appears we will receive the same and level funding in both state and federal block grant funds as well. So very, very good to hear. We did hear from the department that while we may start off with the same state and federal block grants, that they will reassess as the General Assembly continues through their budgeting process. So we could possibly face a change mid-year. And so for that reason, as we reported to you last time as well, although a lot of items are included in our budget, we're not moving forward with the expense until around the January timeframe. We went over this before, but I'll go over it just very briefly to remind you of where we are, what we're planning for fiscal year 2021. If you look at on the very left-hand side of this chart are our program areas. The first 3 are our performance contract programs, mental health, developmental services, and substance abuse. The fiscal year 20, and then so the total performance contract programs, and then our other programs. Our other programs consist of early intervention, healthy families, and transportation. So if you look at the column labeled fiscal year 2021 budget, we have $40.4 million budgeted for our performance contract programs, $6,278,000 for our other programs, for a total of $46,757,000. That's 3% higher than the fiscal year 2020 budget. Our allocation of resources is on the pie chart on the right-hand side. 43% is allocated to developmental services, 34% to mental health services, 9% to substance abuse services, and 14% to the other program areas. And you can go to the next page, please. The department requires that you specifically approve the performance contract budget. This table breaks down the revenue by source, whether it's state, local fee revenue, federal, etc., and by expense type. So if you look at the fiscal year 2021 budget column again, you'll see that we have $40,479,000 budget for our performance contract programs, which is 2% higher than the fiscal year 2020. The pie chart on the right shows you our revenue sources. 67% of our revenue comes from fees, followed by 21% from state funds, 4% from federal block grants, 3% from local funding, and 5% is other, and other represents small grants, and carryover funds from restricted funding sources. If you go to the next page. This page is just a better visual of the revenue type, the revenue sources by each of the 3 major program areas. So again, mental health relies pretty equally on state funds and fee revenue, where developmental services, the column in the middle, lies almost completely on fee revenue, and substance abuse programs rely heavily on federal block grants that are restricted to specific uses. The next page, please, page 5. This slide is our local funding for our performance contract programs. The donut graph on the left are the number of individuals served for the last complete fiscal year, which was fiscal year 2019. The chart at the top right shows you the 2020 contribution per capita from each of the 5 localities. And the table at the bottom shows you the contribution by locality that we have budgeted for in fiscal year 2021. And again, it looks like we'll receive level funding from all of our localities. You may notice in the fiscal year 2021 column that Caroline is higher than the fiscal year 2020 column. At the time we put the budget together, we inserted into the budget what we requested from Caroline County in fiscal year 2021, which is also what we requested in fiscal year 2020. We just did not get the full amount we requested. So in all likelihood, we will probably receive the same level funding from fiscal year 2020 from Caroline County. And when we hear the official word, we will adjust accordingly. And I'm going through this pretty quickly because you've seen this, but just to kind of remind you, and then we'll take a little bit more time when we get to the specific program areas. Next page.
Hey, Rhonda, before you go on, you said that the state may reconsider the funding levels. Will the local jurisdictions also, are they thinking about coming back later and redoing their budgets?
I haven't heard that, but I would say probably nothing's off the table as each locality carries forward with what they think is going to happen. There's still a lot of the whole state of emergency, COVID-19 is still going to impact the economy beyond just what we've experienced now. So I would say nothing's off the table. And Jane, I don't know if you want to interject because you've been listening to more of the council meetings.
Yes, the thing I've heard is some localities are going to hold payment for a quarter, or are going to give like 75% of what they allocate and then wait. That's been discussed, but we've received nothing formal.
Okay, and the fact that we've requested basically level funding, it's not like we went out asking for a 10% increase or something, which would certainly be at risk. But
yes.
Okay, all right, thank you.
This slide shows you the cost by program for our mental health programs. So as you can see, our outpatient medical program is the costliest program to run, followed by crisis stabilization and outpatient program, mental health outpatient. Next slide. In our developmental services program area, the group homes, which are labeled as intensive residential services, cost the most, to operate, followed by our day support program, RAAI, and our intermediate care facilities. And just as a reminder, the intermediate care facilities report our costs every year, and then a new rate is established every year based on our cost up to a ceiling.
So if we can go back to the developmental disability page. We still have supportive residential services in there. One of the things we talked about in process, and I'm not sure where it stands, is that we will be seeking to have that one individual receive services from a different provider because it costs us more to retain that program for one person. So that is one of the cost saving measures that we're doing at this point.
Okay. Next page. Our substance abuse program area, the cost by program, substance abuse outpatient, obviously the highest cost to operate, followed by the medication assisted treatment program. And that assumes that the medication assisted treatment program is operating at closer to full capacity, and that's what we budget for. And if that happens, then that's around the cost of that program. The next slide shows you the cost of our non-performance contract programs. Early intervention cost more to operate than both the Healthy Families and our transportation program. Next slide. This slide is a breakdown of our expenses by the three major performance contract program areas. And as you would expect, since we're a service organization, that the majority of the budget is spent on personnel, on salary and fringe, followed by operating and admin. The budget, as far as changes to our expenses in fiscal year 2021, we did include a 6% health insurance premium increase. Normally at this time, we typically ask you for a 2%, if it's appropriate to do so, a 2% salary increase in July, and then we budget for a 1% in January. We had enough time to strip the 2% out in July because we knew it would not be appropriate at this time. We have included the 1% in January, but we will reevaluate that in December like we normally do and bring that to you once we see how the first half of the fiscal year is going and whether we receive how fee revenue is going and whether we receive any changes in funding. We have a couple of new positions in there. Largely we have a hiring freeze and a salary freeze, but there are positions that are either need to be replaced or they were already approved prior to the state of emergency. And that's a sponsored placement position, 2 intellectual disability support coordinator positions, a substance abuse prevention position, and 2 permanent supported housing positions.
And I would just add for the new positions, the substance abuse prevention and the permanent supportive housing positions are grant funded. The support coordination positions are important now because, and the number's going to escape me, we are getting new waivers as of July 1st for our region. So we needed to add those positions. They'll be able to sustain themselves, but we needed to add that because we're expecting more people to be needing services.
Okay, next slide. So as we talked about at the last board meeting, what our challenges are for this year, really all around COVID-19 and how we're able to phase back in services and whether there are any challenges with phasing back in. So for now, our capital projects are on hold, and that includes the development of 601 Lafayette. There's a salary freeze in place, and that's for the overall for the overall staff. I mean, there may be instances here and there where it's appropriate to do so, but there will be no across-the-board salary increase in July. And we will reevaluate the appropriateness of an increase in January. Training and conferences, unless they're grant funded or free, are generally on hold until January, at which time we'll reevaluate. Jane just mentioned we're evaluating terminating the Developmental Services Supported Living Program. We do not collect enough in fee revenue to cover the cost of that program, which is not always, as you all know as board members, is the bottom line is not always the decision for terminating a program, but when it makes fiscal sense and programmatic sense to do it a different way, then it behooves us to look at that. Marketing costs, we consider.
Can I interject a question there? Jane, you mentioned looking at a different provider for that. So does that mean they will take over the this person so that we can actually terminate the program?
Yes, we would give up our license for that service because there are multiple private providers that can provide that service.
Okay, so changing providers means we're able to actually back away from doing that program altogether.
Correct. And then in the future, it doesn't prevent us from revisiting that line of service again.
All right, thank you. Sorry, Rhonda.
But we wouldn't have to incur the overhead cost of running that.
Correct.
And whatever organization would take on that individual can spread that cost across, their whole program.
Right. Yes.
Okay.
We will delay reopening the respite program, Myers Respite. That program operates at a loss, so that takes a little bit of financial pressure off. And as Jane mentioned in program planning, we'll use that facility to start providing day support services to individuals who live outside of the group homes. We'll evaluate the timing of restarting the transportation services, and that will be largely dependent on when we start the day support services back up, phasing in more of those services for outside RACSB residents and our psychosocial rehabilitation program.
I would just add to that as well. I really see transportation services phase 3 and beyond in terms of how the governor's been structuring it. I imagine that we may be able to open some of the day programs before transportation, but transportation is going to be really difficult with the vulnerability of the individuals we serve, plus trying to have distance in vans and how busy they are. I mean, how full the vans are compact. So that remains a challenge, and we do have drivers that are laid off and furloughed now because of that.
Jane just mentioned the layoffs and furloughs, and again, they were primarily transportation and our day support, our AAI program. Hopefully we won't have to do, and I believe it was 30 people altogether. Hopefully, is that right? Hopefully we don't have to do any more, but we have to, we always have to look at it if there's a decline in fee revenue or if any of our state, federal, local funding is cut. And then calculating the cost of reopening the facilities, and we'll adjust the budget as needed for that. So we constantly meet. We meet twice a week about what we need to start reopening as far as screening and cleaning supplies, and what do we need to do at facilities on a large scale and a small scale. So it's not inexpensive. We'll continue to look at that as well. So that's the overall.
So these challenges, Rhonda and Jane, are you looking for us to revisit these on a quarterly, monthly, in 6 months' time? How are we going to address these?
I see, as every finance committee will talk about revenues and expenses, and that's our opportunity to let you know then how things are going. And so we usually have a mid-year budget increase, but if we need to make a change, we may need to make a change before mid-year. So I think it's appropriate to talk about it every month at the finance committee meeting.
Yes.
Okay, so we should see this list every month then, and try to evaluate what the impacts are going forward, and which, can we do training in November as opposed to January, or
sure. Yeah.
or wait till next March or whatever. Okay.
That's good.
Or give a raise right now.
Okay, we'll do that. We'll do that, as well as if there are things that we haven't even thought of yet in terms of challenges. So that's a good idea. We'll just keep revisiting this as part of our monthly finance meeting.
Thanks.
Mhm.
And then the next page, this page goes program by program, shows you what our actual expenses were in fiscal year 2019, what we budgeted in this year, and what our budget is for next year. And then the difference between this year's budget and last year's budget. So normally we have another column on here that is a fiscal year forecast, but we put this together really early on, and we start working on this really early on in the year. And the forecast we put together was before the COVID-19 really hit hard. And so it didn't seem appropriate, as we didn't know what was going to happen the last 3 months of the fiscal year. So we've made some estimates, but there was so much unknown. So we took that out, and so we're comparing budget to budget. So when you see that there's a variance, we've mentioned earlier that there's really no new revenue coming in. So when you see there's a variance between this budget and last budget, it's largely because we looked at how the program was operating this fiscal year and determined where we needed to shift resources around so that we could cover the programs in fiscal year 2021. So it's more of a shifting of resources. The budget is 3% higher than last year's budget, and that's a safe increase given the what we know about state local funding, fee revenue, and how expenses turned out this year. And I'm gonna get my notes here. And I wanted to go program by program. All right, hang on, I'm having technical difficulties.
I'll jump in for a second while you do that, Rhonda, and just point out some of the things that came up when we talked about the draft budget. The Kenmore Employment Services line, that was a grant received through DBHDS, so that looks like 100% variance, but that was just because we got it last fiscal year and we'll be using it this fiscal year. So that was last minute new money that just isn't going to be carrying over this year. And
I
then,
can't get to my notes. Oh, go ahead.
okay, sorry. And then I was just say the PACT variance is due to some carryover issues. Is that correct?
So there's nothing I need to do like it.
So their PAC funding is less, that's primarily because of how the fiscal year 2020 turned out. There were less expenses than we budgeted for initially, so we budgeted less for the program next year.
Gotcha.
And I'm having difficulty getting to my notes, so I'll just kind of start from the top and point out any variances that seem unusually large and try to go from memory of what they're for. Jail diversion is one where it looks like we're budgeting 61% more in fiscal year 2021. And that is a grant, and the 2021 budget is higher simply because of the amount that we anticipate the program will carry over into the next fiscal year. The inpatient program budget is 26% less, and that's the inpatient program is where we pay for hospitalization for individuals who are indigent, do not have any health insurance coverage, and then we get reimbursed from the fiscal agent for the state for those costs. And we just did not incur as much expense this year as we anticipated, so we decreased the budget for next year. And it's reimbursable, so whether it's higher or lower, I mean, there's a limit, of course, to what the state funding available at the state, but whether it's higher or lower, it is reimbursable.
I would
Jane,
say that, oh, sorry, I would just interject that those expenses decreased probably because of Medicaid expansion. There are more people that have Medicaid now that will pay for inpatient care, so this state money doesn't have to be used as much.
Right, absolutely. We talked about Kenmore Club. Permanent supportive housing, it looks like a 63% increase next year compared to this year. That's a new program. It got started later in the year. They're rolling, but because it got started later in the year, they'll have a lot of carryover, and that's restricted funding that can't be used for any other purpose. So we carry that over and add it to what we're going to receive from the state for fiscal year 2021. Let's see. Supportive residential services show, it looks like a 14% budget increase. That's more a response to positions. There's one less position than in fiscal year 2020. And also the coordinator's time is now, a big chunk of her time is devoted to the permanent supportive housing program. So we shifted some expenses out of supportive residential and into permanent supportive housing. Assessment and evaluation program shows a 17% increase, and that's largely based on experience this year and how staff are allocated that complete assessments. You can go down to the next program area, developmental services. Two big programs that jump out: intensive residential services looks like a 12% increase, and supervised residential services looks like a 12% decrease. That is just how we're budgeting for the respite facility. Last year it was in supervised residential services. This year it's in intensive residential services. And that's changed a couple of times with how the state wants us to report that, and that might have actually already changed since we published this report. But one way or the other, it's in one of those categories. Our supportive residential services, although it looks like a big variance, a percentage increase, it's really only $7,000. And then in our substance abuse program area, the big decrease is in prevention. And that is largely due to the fact that prevention got several one-time grants this fiscal year that we don't plan on them getting next fiscal year. So we did not include that in the budget. And we often don't know about some of these grants until the federal fiscal year starts. And then under other programs, the transportation program is a 14% decrease, and that's just largely based on our experience this year. Which, as Jane mentioned, transportation is, it'll probably be the last to come back online, so we'll keep you updated each month on how transportation transpires. And that is our fiscal year 2021 budget. Any questions?
I have just one question. Sort of going back to the challenges and capital projects. Do we, are any of the buildings, filter systems, air handling systems need to be improved because they're end of life, or you know, they just need to be better? Is there anything like that on our capital improvements list? I don't remember that we might want to do anyway.
Sure. We always have HVAC systems as a line item in our capital projects. As some of the units are older, we have the maintenance. We have Southern Air is our vendor who does the maintenance, and they come out and they give us an assessment on what they think the life is, any issues that they see, and we put a placeholder in based on what we get from them. Everything's operating well now, but yeah, that's a great example though of when we might have to do a capital project, even though we want to put them on hold. There are going to be some that are just necessary to do, but they're none that we had anticipated having to replace in fiscal year 2021.
I think I remember it mentioned that anything health and safety related, you know, was actually not on hold. And I would put that in that category.
Sure.
Yeah.
Okay. Any other questions for Rhonda on this topic? All right, thanks, Rhonda. We, we'll certainly look forward, as we go month to month to see what the state's providing and how our income is, and we'll go from there. But all right, so the next item on the agenda is the April.
We do need a vote on the budget as a
I'm sorry.
That's okay.
Yep.
A motion.
All right, so no further discussions. I'm looking for someone to raise a motion to approve the budget as presented.
So moved.
Thank you. I have a second.
Second.
All right, got a motion's been made and seconded. All those in favor, please signal by saying aye, or Jane, do we need to do a roll call?
We do, if that's okay. So Matt,
Aye.
Debbie,
Aye.
Linda,
Aye.
Nancy,
Aye.
thank you. I think that's it.
All right, motion carries. Next up is the April 2020 financial report.
Okay. Randy, you could go to 14, page 14, please. These are our financial results for the fiscal year as of April 30th, 2020. April is the 10th month of the year, so what we want to see is that revenues are at 83% of the budget and expenses are at 83% or less of the budget. The first category are our mental health programs. And if you look at the actual variance column all the way at the bottom, you'll see that mental health programs for the fiscal year as of 4/30/2020 had a positive variance of $842,485. There were a few programs that are showing losses as of the end of April. The first one is the inpatient program. And we just talked about that's a reimbursable, those expenses are reimbursable. So it's just a matter of timing before we receive reimbursement from the state fiscal agent to cover the cost of sending individuals to an inpatient facility. Our medical outpatient program is showing a loss of $26,000. That will largely be offset by our last quarter local funding from Fredericksburg. They actually got behind a quarter. Actually, it's not even the last quarter, it's the third quarter. They had an issue with their payment system or turnover or something, but so they got a quarter behind, and so that will largely be offset once we receive that. Our psychosocial rehabilitation or Kenmore Club program is showing a loss of $65,997. The program basically had to close for a week and then had to gear up to provide telehealth. They really geared up quickly, and that's going to really save them a lot. They geared up quickly. Still, it's tough to be 100% of the billable units that they were providing before, but they're actually getting pretty high. And then the supervised residential and supported residential programs combined are showing a loss. And that's largely due to the fact of how we budgeted for those programs. We budgeted assuming the programs would operate as they did the previous fiscal year, where we had discharge assistance planning funds that covered a lot of the services. We also had almost $200,000 in funding for the Bridgewater facility. The Bridgewater funding was cut out completely, and then how discharge assistance planning funds are applied is different this year, as we talked about on a couple of different occasions than last year. So it was more of a, had we known all of that impact, we would have allocated more unrestricted state funds to the residential program area. So we know more of how that, what we can expect in fiscal year 2021. So we budgeted differently. Next group are the developmental services program areas. If you look at the actual variance column all the way at the bottom, you'll see that the developmental services programs have a positive variance of $752,663 as of the end of April. Day health, there are a couple of programs that are showing a loss. Day Health and Rehab, which is RAAI, is showing a loss of $111,000. They're still they're still in good shape compared to how they were in the past fiscal year. They've done so much work in getting the services authorized and the right services and the right mix of services, and then COVID-19 hit. So again, there was a week or so of not providing any services, and then there were limited services provided to individuals that reside only in the group homes. The good news is Medicaid is going to reimburse for 65% of the lost revenue for services that they authorized that we could not provide. And they're going to do that through mid-June. So we're working through how to actually do the billing so it will actually get paid and not rejected. So it's a lot of input into our system to make sure we get it out correctly. So very good news for RAI in terms of recouping some of the lost revenue. And then into, as we talked about, our program planning, we'll start to be able to provide services for individuals that reside outside of our group homes, and then slowly open the facilities to get individuals out of the house. So it'll be a while before they're 100% back and running, but they are, providing services when and where they can in a safe way. The Respite Facility is showing a loss of $269,625 as at the end of April. And as we discussed in all the meetings, this program operated at a loss. It doesn't generate enough fee revenue to cover the cost of providing the service. This facility is closed for respite services at this time, so that takes a little financial pressure off. And we're able to use the facility for day support services going forward. The intermediate care facilities are showing a loss of $13,771, and that's largely due to a cost settlement payback for the Ross facility. And again, each year we have to report our expenses, and the fee is, the rate, every reimbursement rate is recalculated every year. And then lastly is the supported living program, which shows a loss of $16,873 as of the end of April. And we talked about that program. We anticipated it would show a loss since it costs more to provide that service than we collect in fee revenue. And the next page, please, Brandy. The top chart is our substance abuse program areas. And if you look at the column, the actual variance column, all the way at the bottom, you'll see our substance abuse program had a positive variance of $788,424 as of the end of April, and all the programs had a positive variance. The chart below that are our performance contract programs that are considered outside the three major program areas. If you look at the actual variance column, the number at the bottom, those programs had a positive variance of $300,823 as of the end of April. Only one program showed a loss of that's our Child Mobile Crisis program, that had a loss of slightly over $11,000 as of the end of April. We get funding from through the state fiscal agent. We get state funding through a fiscal agent for that program, and the payment was a little delayed, and I believe, I'm almost positive it was received in May, and that'll offset that loss. And the next page. The top are our administrative services, all services that are not covered by the revenue that's allocated to those two, not programs, those two areas. Any expense not covered by revenue is allocated to all the programs. And as of April, that allocation was 78% of the budget. So we're holding to the budget as far as our administrative overhead. Our other programs that are outside of the performance contract programs is the next block. First is transportation and Kids on the Block, both showing a loss. And we've talked about transportation. The program cannot collect enough in fee revenue to cover the cost of the program. So the programs that they provide transportation for, Kenmore Club and RAAI, subsidize that program. Now, both of those programs are having a tough time because of COVID, so we'll end up subsidizing transportation from other program areas that don't necessarily use transportation. Kids on the Block program operates at a loss, and we subsidize that from other program areas. They do not generate any revenue other than donations. Our fiscal agent programs are at the bottom. Our first fiscal agent programs are early intervention programs. And if you look at the actual variance column, you see that our total early intervention, or Part C program, had a positive variance of $292,526 as of the end of April. Our early intervention program is showing a pretty large loss. That program, just in general, the services, it costs more to operate than we collect in fee revenue, which is why we have the Interagency Coordinating Council revenue from the state and federal block grants in order to cover costs not covered by insurance. We try to maximize our insurance collection, though, so that we don't use up all of our Interagency Coordinating Council money. And it was certainly challenging at the beginning of the year when Medicaid outsourced early intervention coverage to managed care organizations. We experienced a lot of denials. We're still rebuilding some of those denials. They all require research, but we've really got it down to a pretty good level. And we do all of that, try to maximize our fee revenue before we pass the services along to Interagency Coordinating Council to pay for. The billable units also decreased when COVID-19 hit as well, and they're providing some telehealth services, but not all families wish to receive services that way. So kind of been a challenge all the way around.
I'm sorry.
Go ahead.
Just wanted to emphasize again with the early intervention and the rates that don't sustain the cost of the service. So if you remember, pretty much every year for as far as I can remember, it's been an item in the General Assembly to increase some of the infant case management rates and number of other early intervention rates. So that'll be an ongoing discussion.
Lastly, there are Healthy Families program area, and Healthy Families in total had a loss of $15,000 as of the end of April. You could see the big losses in the TANF grant line, and we have not, are just waiting on payment from that grant source, which should cover, pretty much offset that variance right there, I anticipate. So they should be in okay shape. Next page. This page just recaps our revenues and expenses by the program areas, compares them to the last fiscal year for the same time period. And revenue-wise, we have a total of $36,938,000 as of the end of April, and that's 1.73% higher than last year at this time. Our expenses were $34,044,000 as of the end of April, which are about 3.69% higher than where they were last year. So we have a net of $2,894,400, which is 16% less than where we were last year at this point of $3,474,000. So we continue to be in revenue-wise still looking pretty good. And we shared with you, I think at a previous Finance Committee meeting, how we now have to really pay closer attention, though, to those programs that have restricted funding versus non-restricted funding to make sure we don't dip into the restricted funding valve, the funds that are restricted for specific uses.
That sort of leads to the question, Rhonda, of that 2.8 million, how much of that is restricted?
About $1 million of that is restricted. As of, I tell you, I looked at it in March, and I need to run the numbers for April, but as of the end of March, it was $1 million of that was restricted, and about 800,000, a little over $1 million was restricted, about 900,000 was unrestricted.
Okay, thanks. Okay, any questions on the financial report? All right, I think I said at a previous meeting that since this is sort of everything about the program, I believe that we ought to approve this report on a monthly basis. The rest can be, for the most part, information, but I'd like to have a motion to accept this report as presented.
So moved.
Okay, can I get a second?
Second it.
Thank you, Nancy. So we have a motion's been made and seconded, and Jane, can you read the roll for us and we'll vote?
Yes, sir. Thank you. Debbie,
Yes.
Linda,
Yes.
Nancy,
Yes.
and Matt.
Yes.
Thank you.
All right, thank you all. So we'll move into the financial trend report. Tries to put some, this will try to put some sense to what we just got.
Yeah, yeah. Visually makes it easier to see. Brandon, you can scroll down to the first graph. Yeah, there we go. These charts are for the mental health programs. The chart on the upper left are the number of individuals served by program area. So we have revenues at the top right, expenses at the bottom left, and then the variance, which is just revenues minus expenses at the bottom right. So the mental health program areas, they served more, mental health overall served more individuals this fiscal year compared to the last 2 fiscal years. All of them programs are showing a positive variance except the ones we talked about earlier. The psychosocial rehabilitation or Kenmore Club and our residential programs. The variance was much higher in fiscal year 2018, and that's largely due to the PACT program. That PACT program was newer. They had a lot of state carryover funds than they do now, because we use up, the more individuals to have, the faster we use up those state funds. Okay. The next page is a developmental services program area. Developmental services served more individuals this fiscal year than in the past 2 fiscal years. And all of the programs are showing a positive variance except for the ones we talked about earlier, RAAI. Oh, and this is what I was talking about. If you look at the day health and rehab, so even though April has half a month of operating under state of emergency COVID, day health and rehab was still doing better at the end of April than the past 2 fiscal years. We talked about the respite facility, how it operates at a loss, and you can see that's pretty consistent with the past 3 years as well. Okay. The next page. Are the substance abuse program areas. And again, the substance abuse program areas served more individuals this fiscal year than in the past 2 fiscal years. All the programs are showing a positive variance, and the variance this year is less than it was last year, but more than it was in 2018. And again, if you recall, the substance abuse program areas, the funding for those programs comes largely from federal block grants. And so the number of federal block grants and the amount we carry over is generally what creates the variance in those programs. And then the next page. These are what the Department of Behavioral Health considers other programs. They're covered by the performance contract, but they're not included in one of the 3 major program areas. It's their emergency services and assessment evaluation type programs. and they served fewer individuals than the past 2 fiscal years. All the programs are showing a positive variance except for mental health emergency services and the child mobile crisis. And child mobile crisis, we talked about that. We're missing some funding from our state fiscal agent, and that should turn that around, so it's pretty comparable with the last 2 fiscal years. And then the last slide is the Part C, our early intervention program areas. The program areas served more individuals this year than they did in FY18, but almost flat from last year, and both years higher than fiscal year 2018. All of the programs are showing a positive variance except for the PED program, and the variance is less than the past 2 fiscal years. And we talked a little bit about the challenges with the PED program earlier. So as the Part C is really not a program, so to speak. It is the fiscal agent for the early intervention programs, and so that funding is used to cover the cost of infant case management and the PED program that's not covered by insurance reimbursement. And that summarizes our trends for the past 3 fiscal years.
Thank you, Rhonda. Any questions for Rhonda on that? No? Very good. And we'll move on into the investment report.
Okay. And Brandy, you can go to the next page. This report is a summary of our cash and investments as of April 30th. We had $3.6 million in our checking account at Union Bank and CDs totaling $11,250,000. And we had a small position in the local government investment pool of $31,754 for a total of $14,890,298. So still in a good, healthy financial position. We did cash in a $500,000 CD in the month of April, anticipating that fee revenue would be lower because of the reduced services due to COVID-19. So you can see in the chart in the bottom how there's a dip in the CD line and a small increase and an increase in the cash line. We had, so our cash on hand is actually 2% higher than it was in March. It's 24% lower than the prior year. The change from the prior year are due to capital projects that we've used reserves to fund. We have not had to dip into reserves for operating expenses. So as of the end of April, we had about 4.5 months of reserves on hand to cover operating expenses.
Rhonda, the CD we cashed in, had it matured, or did we have a penalty?
It had not, it was close to maturity. It had not matured. Oh, I'm glad you brought that up, though, because I want to say something about CDs. We had a penalty-free withdrawal, so it did not cost us anything to withdraw that $500,000 CD. Oh, this is going to look ugly on the next report. Our rate that we were enjoying on our CDs was 2.62%, and all of the CDs expired. And the new rate, as you can imagine, with everything going on, is something like 0.5%, a lot lower, unfortunately.
0.5% lower or 0.5%?
0.5%, period. And that's higher than their normal rate. If you called the bank and asked for, you know, jumbo CD rates and whatnot, you would get a lower rate than that.
But our checking account's getting 1.25.
Yes, we have our checking account is in an insured cash sweep, and that's going to change as well, though. Thank you for bringing that up. And I cannot recall the new rate off the top of my head. We have our checking account each night, all but $100,000 is invested in what Union calls their insured cash sweep program. It very much works like a CDARS program where it's invested in several different banks on an overnight basis. That rate's going to decrease as well.
Okay. Any questions on the investment report? No, very good. Thank you, Rhonda. Moving on to the reimbursement report then.
First, to point out the date at the top of the report says April 31st. I apologize for that. It should say April 30th. The first column of the chart shows you our total claims outstanding by how old the claims are. As of the end of April, we had claims outstanding totaling $4,452,000. And just a reminder, we do not collect 100% of everything we bill. Our collection rate is more around 60% for a couple of different factors. For many of our programs, we bill at a higher rate than we know we're going to get because we don't want to miss out and bill at a lower rate than we might actually receive. And also, not every claim is paid. A good number are denied and we have to rebill, or they're denied for a reason that we can do nothing about, in which we have to write off. So our largest claim bucket are claims that are under 30 days old. 51% of the outstanding claims are less than 30 days old. The next largest bucket is our claims that are aged 120 days or more. 70% of those claims that are over 120 days are due from consumers, and 503,000 is due from third-party insurance payers. We're not aggressively, we don't have any aggressive collection efforts at this time for consumers, and we look at all of our older claims first when we bill. We did slow down on write-offs, though. Our reimbursement coordinator, Megan Toller, who you usually hear about, she wanted to take a closer look at write-offs before they occur and make sure that we were doing everything we could to collect on them before we write them off. And largely she's finding that we do, and the group is making every effort to collect. And so we've started writing off claims. So that number will probably go down over the next couple of months. At the bottom of the report, those are collections. And you'll see that despite the challenges with, especially this year with the managed care organizations, we're still collecting more. We collected more as of April than the same time period last year, 6% increase, and you can see that in the chart as well. So our fee collections continue to be strong. We will see, we saw a little dip in the programs that had to pull back on services due to COVID-19, but then an increase in some, like mental health outpatient, that really just were able to really start strong with telehealth. And that's it for the reimbursement summary.
I would just highlight again, Miranda's team that looking at that revenue cycle is really, as you see through the years, really done a great job at looking at claims and figuring out processes and making sure we follow up with insured companies and the MCOs. If you remember, 6 managed care organizations with 6 different rules and processes we had to absorb, so they've done a great job.
She also had staffing challenges.
Yeah, what makes it especially challenging is someone will lose coverage, and then when they get back on, they first are with a fee for service managed. Before they're assigned to a managed care organization, they're assigned to a fee for service guarantor. And so that lasts a short period, and then they're assigned to a managed care organization, at which time they have so many days to switch to another managed care organization if they want to. So it is, it's not just a matter of, I have Anthem and that's who, maybe it changes occasionally. I mean, that really changes quite frequently. So it's a challenge to keep up with the coverage that individuals have.
Okay, very good. Next is the health insurance account report.
Brandy, if you could scroll down to the next page. The chart at the top shows you our claims and fees associated with our health insurance program. And you can see where we are actually slightly, basically level with where we were last year in terms of health insurance claims. And that's been, that's pretty big. And that it's a result of changing the plan design a little bit. The last month, though, claims were also, actually 2 months really, claims were down a little bit compared to the prior year. It was hard to get in to see a doctor unless you were willing to do telehealth, and even then they weren't up and running right away. So as of the end of April, we have deposited $3 million into our health insurance account in the form of premiums. Our claims and fees were $3.2 million, so there were 2 times during the year that we had to make additional premium contributions into the account. As at the end of April, the account had a balance of $231,000. And at the bottom of the report are statistics that compare this fiscal year to past fiscal years. So on average this year, our claims are $321,000, which is slightly below where they were last year. Still higher than all the previous years, though. So hopefully this trend continue. I mean, I hope people can get back in to see their doctors, but hopefully the plan design change that we made based on the recommendation of our insurance consultants is we're starting to see how that benefits us in terms of lower liability to the agency for paying the claim. There was a slight change in plan design for this coming fiscal year as well, and so hopefully that'll keep us on level ground.
Okay, very good. Any questions on the health insurance report? No? All right, very good. Then we'll move on to the other post-employment benefits.
This report's a little hard to read, I apologize. This is a report of our trust fund for other post-employment benefits that is used to reimburse retirees with 20+ years of service for health insurance or for their Medicare supplemental plan. If you go to the last row on the chart at the top, you'll see that the balance as of April 30th on a cost basis is $1,593,000. On a market basis was $2,430,000. So you can see in March and April that in March, due to, we started having investments don't do well in pandemics. Let me say that. So there was a $251,000 market decrease in March, but we made up $172,000 of that in April. So the fund continues to perform well.
Yeah, except for the dip there. I mean, the red line is still at a steady growth or good,
Yes.
A decent slope. Okay. Anybody have any comments, questions? Nope. Hearing none, then we're on to other business, and which I don't have any, except to say we'll do the same thing next month, right?
Yes.
And other than that, anybody else have anything to bring up?
Thank you all for joining today. I think it's worked
Thank
well.
you all for your hard work.
Good job, Rhonda.
Yep. Way to go, Rhonda.
I'm just reporting what the programs are doing. It's a way to go to the programs. If you can imagine the